Sherry Mativier and Provincial Constable Byron Hornick are planning their day at Essex County OPP headquarters. It looks like they're going to be busy today.
Possibly a hoarder, possibly dementia. So I think that she should be the top priority.
Sherry and Byron comprise the Mental Health Response Unit. The initiative is aimed at helping those with mental illnesses who are in crisis and whose needs are not being met by the healthcare system. Hornick says police officers repeatedly encounter individuals like hoarders or those who suffer from a psychosis. He says police officers can do little to help those with special mental health needs.
You know that you're going to be there again, be it in a couple hours, a couple days, or a couple weeks. You're going to be there again giving the same advice and dealing with the same issues and without any positive outcome.
In a county the size of Essex, it can be difficult to access mental health services. Many residents who desperately need help live in an isolated rural area, making it challenging or impossible to travel to treatment. These individuals simply fall through the cracks of the healthcare system, becoming that so-called weird neighbor next door. In some cases, even meeting basic needs can be too much. And that's where the Mental Health Response Unit comes in.
Is there food in the fridge? Is there heat on in the house? Is there actually a roof over their head? Are they struggling? Is there anything we can do?
Many of the clients that Sherry and Byron serve are isolated from the greater community geographically and socially, just like the person they'll meet today.
My name is Sherry, and this is Byron. I was wondering if maybe we could take a few minutes, sit down, and talk about what's going on.
Sherry and Byron have received reports that the resident of this home is exhibiting early signs of dementia. Sherry's mental health care expertise is critical to the program's success. Byron's role today is to ensure the lady's home is secure and to step in should Sherry need protection. It quickly becomes clear that the homeowner is in distress.
I'm telling you, I can't take this. Every time I go to the store, somebody's in my house stealing something.
She's distraught and terrified. She's convinced people are breaking into her home when she goes out.
The one boy was in here, blonde, tall, blonde. He was in my house. I'm scared. I'm telling you the truth. I don't feel sorry for myself, but I'm scared.
Sherry catalogs the client's medication. She's worried about the homeowner's physical and mental state.
I'm fearful that this could potentially land you in the hospital or cause some very serious health problem.
They're going to come in and kill me, I know for sure.
This is not good, this is not healthy, and we don't want to come back and find you dead. We're not going to just walk away and say, okay, goodbye, and then you having to wait until the next time there's an incident.
The Mental Health Response Unit launched in December of 2012. Today, the program handles between 40 and 50 cases just like this one every month. Those who work on the front lines of emergency services say the project made an impact right away. Inspector Rick Malott of the Essex Fire Department says firefighters are encountering an increasing number of individuals suffering from mental health issues, usually hoarders. Malott says the Mental Health Response Unit is making a difference.
They are able to address the mental issue involved with hoarding, and then continue on with that and in reassuring that the resident gets the mental health care they need if they are not able to get that through a referral by us. We would normally attend and make a reference for them to contact Canadian Mental Health Society.
Byron and Sherry are proud of what the team has achieved in a little over a year's time. They point to an incident in which an elderly man was suffering physical and mental abuse at the hands of his wife, who was in the early stages of dementia. The team quickly found a facility to care for her.
He's a new man. He's stress-free to a certain extent. He was very appreciative and happy. He can visit his wife now at his leisure and are supervised, and he feels that she's safer now where she is, and she is. And so is he, so success.
We've had some very positive success stories about having, individuals who have been going through that cyclic kind of mental health police, and now they are fully supported where they need to be and should drop away from both systems. So, great success.
The journey is just beginning for this client, but now she'll receive the care she needs. Another life made better through the timely intervention of the Mental Health Response Unit.